right, good morning, everyone. Nice to have you all here. I've got Jamie with me today. Just going to let her do an introduction real quick of herself and what she does.
Thanks, Brandon. My name is Jamie Kerrigan. I'm a nurse, and I am the Senior Vice President for Quality, Safety, and Risk Management at OSF Healthcare. It's a system in Peoria, Illinois. I've been there, I think, 9 years now, originally starting as the Director of Regulatory Readiness and eventually just adding more to my plate. So that's what I do there now. I've been in quality, though, in some fashion since 2005.
Ah, well, thanks, Jamie. It's a pleasure having you. So tell me what it was about nursing that made you want to go into nursing.
Well, I originally, and I think everybody probably has most people I think have a little bit of a winding road for where they ended up where they are. But I originally was an engineering major. And I recall probably we have better career counseling now, but I remember you would take a test in high school and it would guide you towards, which areas you should consider for your career path. And I was always a math nerd, loved the sciences. And I was like, all right, well, sure, engineering, that sounds great. And I hated it. Went to college and I just did not enjoy it. I thought this is going to be boring. I can't, it was everybody was heads down. I'm a little introverted, but I have I need some socialization in my life, and then I need to have my quiet time too. And I was in school with just a bunch of true introverts and that I just didn't really connect with. And so then I was considering, of course, what else I'd want to do because I didn't want to be miserable for the rest of my life. And for an 18-year-old, you think, oh, you think the cool aspect of the job. And I just wanted to build bridges. Like I thought that would be fun to do. So that's how short-sighted I was at that age. And that was not what I was going to be doing. I was not going to be building bridges. So I had, I spent some time around healthcare growing up. My grandmother was a nurse and I would visit her. And, as I was exploring what my other options, I did want to make sure I could get into the workforce in a few years. So I ended up leaving the university and going into a community college originally was my first degree and becoming a registered nurse. More for the fact that it was more of a people oriented type of career. That's what drew it to me. I did want to do something I felt good about and that I thought, would be somewhat buried in what I did every day. And so, that's originally why I went into it. I ended up liking it for many other reasons, but that was kind of the driver.
Yeah, I remember those aptitude tests. Like when
Mm.
it said neurosurgeon, I was like, no.
Yeah.
Those were always interesting to take. Um, so tell us about your career progression and how you ended up becoming the senior VP there at OSF.
Well, I originally, I went to high school on my initial college degree in rural Illinois, and I worked my first 6 months at a critical access hospital, doing like everything like you do in a critical access hospital. And my family had relocated back to Pittsburgh, Pennsylvania, where I'm from, and I thought, you know what, I'm gonna do that. I'm going to go, and I wanted to work at an academic medical center. And I ended up, of all things, I would not recommend this, but at the time I thought it'd be exciting. I worked at UPMC Presbyterian, which is about a 1,500 bed hospital in their float pool. And I started doing just a lot of different things. They would just put you wherever you had a set kind of core competency. And so, I did that for a number of years. And I had my sons and I was a young mother. And it was a bit of a drive in and out of the city. And I was from like a medium sized community. So there was an opening for a charge nurse position for the whole hospital. It's more like they called it a patient care coordinator. It's more like your house supervisor, right? In my community. And at the time, it was more of a choice for my family. It really wasn't a choice for me. I liked what I did. I got to do everything, at UPMC. So I did that a while, but I found myself there also, there were needs, right? It was kind of it was about 70 beds, and they've been through a lot of changes. So I also became the education nurse, and I also became the person who did the project. So eventually, when they needed a quality director, because quality was very young then, they asked me to do that, and I did not even know what it was, honestly. I just I read it, I said, well, it's day shift. And that's how I took it. That truly is, it was not planned. It was not, it was probably like my, how I picked engineering. It was not well thought out, right? But truly, as I thought back, I thought, well, I took that math nerd side of me, right? And then, I took the part of me that really needed to interact with people and kind of get in there and dig in. And somehow it found me. And then I just never looked back. Like that was quite some time ago, almost 20 years. And, I just never have looked back since. I've moved kind of broader in my role and bigger organizations, but I just have really kind of found my niche there, I think.
That's great.
I think I've been thinking things out better since then.
So I know like the day to day isn't nothing's ever the same. I know like my experience in quality, nothing was ever the same every given day. But what are like the roles and responsibilities that you have in your current position right now?
Yeah, and I always said I think for me, um, like hell would be just being on an assembly line, doing the same thing over and over and over. And that is definitely not what I do. I might have a plan for my day and it gets completely turned upside down. And part of that, sometimes it's annoying, right? But I do like that. Like I like that I'm always shifting gears and I interact with a lot of different people. Essentially a lot of what I do and what my team does, because I certainly have really great leaders and mission partners that I work with. Um, we have like these core areas that we cover. So I will just sort of go through them. So we have safety, right? And that is the safety of our patients, safety of the people who work for us, the safety. We work with the folks that keep the building safe. So that kind of key areas, and that includes monitoring the environment. People report events, we investigate them with other people involved, of course, and then it puts systems in place in order to keep things from happening that would harm. So that's kind of like a core area. In my role, I don't get into individual events very often. What I end up doing is we take that information, what have we been seeing, and seeing if we then need to adjust our plan more strategically the next year because of patterns that we might be seeing. We evaluate that ongoing, I would say. Another area really is we have this clinical data center. So it's really measuring the outcomes of the care that we give to patients, and we both send it externally and internally. So externally, for a number of reasons, some of it's the rules, but we do contribute then to the advancement of science that way. So these things were done, right? These are the outcomes to the patient, and that intrigues like the science side of me. And then internally, it will really give us information on what's working well and what's not, so that we know where we need to target for improvement. And I would say that's kind of another big area. My team really leads the clinical strategy. So you have the overall strategy of the organization for growth and finance and all those things, and then you have the clinical strategy, which is maybe implementing evidence-based care. Sometimes we actually develop the evidence. And then the other big bucket is how do we redesign care? It might be more population health based, or it might be internally, do we need a different kind of care setting to help our patients? That's more my, what our clinical strategy has to do with. And then we have a lot of teams working that. So we have this huge project plan specific to achieving those goals. And, I'm one of the people that really oversee that and keep it going. And that's one of the things we've really gotten better at this past couple of years since COVID. We really have that going and efficient and moving some things that we need to move. I'm also on the clinical risk management side. It's sort of the kind of the thing that buckles up against safety. So if something happens, how do we best mitigate that risk? And sometimes it's working with legal on how do we defend it, but it's also kind of the input into what we need to improve too. So we might up something because it's a bigger risk to the organization. The other piece that I have in there that's not really in my title is clinical documentation improvement, which doesn't seem real intuitive for to be under quality, but it is really how we're able to pull information out of the record based on how good that documentation is. And that's what that team does. Very much affects our quality scores because that's what affects the risk adjustment. A lot of these measures are risk adjusted. So that's on a kind of high level what I do. It seems like I do a whole lot more than that, but those are my major responsibilities.
So how do you bring it all together so that you ensure that what you're doing in your departments aren't siloed from what's going on in the rest of the system?
Yeah, I think I view quality kind of as a connector. I think we bring everybody else sort of together. I would say a few years ago we were very siloed, like as an organization. It was interesting during COVID. I think we learned how to talk about things together and then quickly make decisions and communicate kind of across care settings, across care teams better. So we have infrastructure in place and intentional teams communication meetings where these more strategic high level, here's what we're seeing, they are discussed inclusive of, and here's what's interesting, prior we didn't include operations, right? These were like your design people where I am, and then we had the people who executed. Now those people are together, those executives are together, so they're hearing what we're finding, right? And then we're making decisions together. And so there's much more of a partnership and than there was previously. And it's not perfect. I mean, there's always stuff that we're not on the same page about, that we're not coming together on, but there's venues to talk about that and bring that up. So I think the other thing is truly defining accountability for quality. Like, it's not my job. Like, we are accountable to facilitate this process, right? Like, we're we're bringing them along. We don't deliver the care. So everybody has their own accountability, right? The clinicians have to deliver the care according to the things we have in place. The operations executives have to actually execute on that and hold people accountable. Like, everybody has their role, but it's not just my team's job to like get these things in place. And we've really tried to clarify those roles. And I have seen our leaders really own this in a way they haven't before because they understand that now.
So what's the most rewarding part of your role?
There's a lot of things that are rewarding. I think at the end game, when something that we acted on, some, broad system initiative that we acted on really did impact care. And it dramatically, I would say, and sustainably. Like, that's the end game, what we're trying to do. In early quality, it was all, early quality was all about process. It was, you were measured based on, did you put these things in place that CMS said this is a process measure, right? And they've really gotten away from that. There's very few things that are process measures, and rather you're measured by specific outcomes to patients. And that's really how we should look at it, because that's what matters, right? Did we, at the end game, improve care for the populations we serve? So a lot of things go into that really are like satisfying for us, right? That are in the work that lead to that. But that's the end game, I think.
Yeah. And what's the most challenging part of your role?
I think the complexity of it and just keeping it all together. I mean, just the minute details. It's very challenging, and I think what I've learned, at least, is especially as like my role has grown, is that I can't own the complexity. I came in as the system regulatory director. I knew all the rules. Like that was my baby. I built that program, but I'll tell you who is in it now does it better. I defer to her. I'm like, I don't know that anymore. And she has built that program beyond what I ever did. And so I think you just have to know that because it's so complex, you have to have areas that really have that expertise and are on it, right? And then you have to have ways that you're bringing it all together with those folks involved. But it's hard to build that, and it's hard to keep it going. So it's challenging.
Stephanie, do you happen to have any questions?
Hello, can you guys hear me well? You want to make sure. I like what she was saying, like, it's kind of like so funny because like like you never know what you want to do. Like you start off with one career and then you find out like what you end up liking. That's how I was. Like I was telling Ray, like I liked one career, like I love this position, and then later on I was like, oh, this is something I really want to get moving in. And I feel like as being like a nurse, I feel like that's like a really good thing, because one of the things that I like helping is patients, and I like patient care. I like communicating with people, and I love helping people. That's one of the main things why I wanted to be in the healthcare field. So I really love like how like you position yourself. And the thing that you mentioned, that you said that you never know what's going to happen during the day. Like you might plan something and later on kind of like your plans kind of like jumble up, and you kind of like have to like strategize your way through it. And it's kind of a good thing because you learn new things in the process. So I like this meeting. It was really interesting.
Thank you, Stephanie. Yeah, I think one thing you never really can plan your life in general, let alone your career. But I think, I think I've learned most by things that I was very uncomfortable with. I didn't necessarily want to do them, or I did them for, just because there was nobody else to do it. And I was like, somebody has to, it needs to be done. But then you just grow through that. And at the end of the day, like if you're doing it for the right reasons, that was just sort of what I live by. And it's just been a journey. And I think the other thing is I was a very like meek child. Like I was shy. I was like, I didn't stand up for myself. And I've learned to stand up for myself, and I still am less likely to stand up for myself than I am for a patient, because you really can't chicken out, right? If it comes to a patient. So I think well, being a nurse helped me, first of all, because as a nurse, you have to advocate for your patients. Sometimes you just kind of learn to do that with doctors and stuff. And but there have been times that I've had to be pretty bold, and I've just learned to communicate that way better. And now it's sort of like I don't have to push in as much, because people just know that's my role and I'm going to say it, right? And so I think it's led to a healthier culture and just an expectation, right? That's what I should do. If I'm concerned about something, I should speak up. And that, I think that is very satisfying, to know that that's what the organization wants from me, whether they agree with the concern or not. They want to hear it. But it's been a personal area of growth, I think, for me, because that was not who I was.
Well, Jamie, I want to thank you for coming on and talking with us. It was a pleasure having you on here today.
All right. Thanks, Brandon. Good to see you again.
Yes.
You guys have a good weekend.
Thank you.